Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Hi.
Hello.
So we're going to talk about something really, really fun.
Okay.
Root canals.
Yes. And what the procedure is, when do you need them? What are the criteria? What is the current mentality out there about root canals?
There's a lot of stuff about root canals out there.
Yes. I'm going to talk about it from the dental perspective and,
Of course.
How we diagnose what sort of happens, because there's a cultural thing with dentists too, who prescribes a root canal. It's not always so black and white.
Before we go deep into it, what is a root canal?
So our teeth are made up of different layers of tooth structure of different materials. So the very outside of our tooth is the enamel, the hard shell. Then we have something called dentin, which is a little softer. It's in the middle. And then in the very middle of our teeth, we have our pulp chamber and canals, which basically hold the nerves and the blood vessels to our teeth, right?
Teeth actually have nerves and blood vessels. People sometimes don't realize that.
And those are in the canals in the middle of your tooth. So if you have a cavity, it starts out on the outside surface and it penetrates through the dentin, through the enamel, first of all, the outside hard shell, into the dentin, the softer stuff. When a cavity is to that point, then you need, let's say, a filling or even a crown or an onlay or something like that. But if that cavity penetrates into the middle where the pulp chamber is, it's infected or affected the nerve that's there. That's when a root canal is usually recommended or done.
Right.
Okay.
So once it hits that nerve kind of chamber, you no longer can just do a filling or a crown. Now you have to deal with the nerve.
Yes and no, right?
Okay.
So this has to do with whether the nerve has been affected or not. So that's what we're going to get into today. What infects or affects a nerve, and those are the times when we want to actually treat it.
Right.
But if you do end up needing a root canal, we're basically making a hole, usually through the top of the tooth or the biting surface of the tooth, and going right and accessing those sort of orifices to the canal, the openings to those canals. And our teeth have roots. Our front teeth have one root. Our kind of side teeth have one or two roots, and then our back molars sometimes have 2 or 3 roots with multiple canals in them.
Right.
When you do a root canal, it's like doing micro plumbing, right? We are accessing these kind of tubes inside your tooth that are inside
and they all connect and they kind of interweave within your tooth to connect all the different roots of your tooth.
And we're taking these really skinny little pointed instruments we call files, and we're going in there and we're basically cleaning out the nerve, the infected nerve or the affected nerve, whatever, the stuff in there.
Okay, let's talk about this, because this is where the rubber meets the road. What is infected and what is affected?
Sure. So our nerves have that are in the middle of our teeth can have reactions. So they can get swollen. We call this pulpitis. The stuff in there, the nerve is called the pulp.
Right.
Itis just means inflammation. So,
pulpitis.
Pulpitis is inflammation in the nerve of your tooth, right?
And
so,
what does that feel like?
So when you have that, you can have reversible or irreversible pulpitis, which means reversible means maybe you bit into something and you sort of bruise the nerve in your tooth. It's just kind of like, banging your elbow and bruising it or whatever, right? And it hurts when you push on it for a little while.
It's inflamed for a little while, but it can heal itself.
It can heal itself.
Right.
In a tooth, the way our teeth feel or sense is through pressure and temperature.
Yes.
So those are the two things. So often the complaint will be, my tooth is sensitive to hot or cold, or my tooth is sensitive when I bite on it, right?
Or when I tap on it.
So there's pressure on it. So that's pulpitis. The nerve is inflamed, it's swollen, and as you touch it, and it's like, twisting your ankle. Now it hurts when you touch it or you put pressure on it, right? But is it reversible? Usually means that if you kind of leave it alone and give it some time, this swelling can go away. And with a nerve, it can take anywhere from 2 to 3 weeks or a bit longer even, as long as the cause is gone. Like that pressure was from biting on something weird and now it's gone. There's no crack, there's no other damage.
Right. And the younger you are, the more likely that it will reverse itself.
Right. Maybe you had some trauma,
Right.
you fell,
Like if
you banged up your tooth.
or like got hit by something, and now it hurts. But then, especially like young kids, they can very easily
Things
recover.
heal. Those canals to the inside of your head are open and big, and just like reparation happens.
And things heal.
Things can heal really well. So often we're just kind of like, okay, well, let's check on you again in a little while and see if it's better.
Yes.
But if the cause is like you just had a crown done and now your tooth is sensitive to temperature or to biting, it could be that the crown is too tall. And so every time you bite down, there's a little bit extra pressure on that tooth with respect in comparison to your other teeth. So now that one's constantly like you have a bruise and someone's poking it every time you bite down.
Right.
So that needs to be adjusted, or
And that's reversible.
that can be reversible. So reversible pulpitis or inflammation of the nerve, usually we look at symptoms like if it just hurts when you bite or drink something cold, but it goes away right away and it doesn't linger, it doesn't like ache on its own, it doesn't start throbbing.
Not like sharp shooting. Some
Constant
of the words that people use when it's not reversible is throbbing, sharp shooting.
Well, sharp shooting that remains.
That remains.
Stays.
Yeah, that stays.
Sometimes they say it's pain that starts here, but I feel it going kind of through my jaw, and that's because our nerves are connected to each other, right? So they feel the pain through sort of the pathway of the nerve.
Right.
Basically.
And sometimes you can't tell if it's an upper tooth or a lower tooth. It's all very vague sometimes because it's all connected.
Because it's connected, and they'll be like, the whole side of my head hurts, because it's just like everything over there is now pulsating from this.
Yeah.
Starts on its own. Pain like that is usually not irreversible. That nerve damage is there, and it's more likely, almost 100%, to be irreversible.
Right.
And so those are the situations. Now that's when it's pulpitis. Now we haven't even talked about infection, but this is just your symptoms, like the pain in the tooth. So if you have ongoing pain that comes on by itself, pain that lingers, you have to take medication for, or just like it kind of radiates throughout your side of your head or your jaw, those are usually irreversible and require, if the tooth is even savable, require a root canal, because that nerve, we got to take that nerve out of there now for you to stop having pain.
The nerve is so inflamed, and the inflammation is not going to go away on its own.
Exactly.
So the way that we deal with it is we just remove it.
Yeah. But if your pain is just too cold when you drink something cold, but it goes away as soon as you take away the cold, or to biting, but it goes away as soon as you take that away, it doesn't linger, it's not sore otherwise, then there's a good chance that it's reversible. And often the culprit is a filling you just had, a crown you just had, some dental treatment that you just had done. There's something wrong with it. Usually the bite is too high or something's going on with it. And so you need to go back and have your dentist kind of reassess it. Sometimes we put a filling in, the filling debonds or unglues somewhere inside. We can't quite tell, but when you bite on it in a specific way, you get a little jolt because that filling is moving just a bit, putting a bit of pressure on your tooth, and that's you're getting the pain.
And you just have it redone, and normally that solves it.
Exactly. Your dentist has to be able to kind of identify what's going on, and sometimes it takes a bit of trial and error to figure it out. And we usually start with doing the least invasive thing, and then spreading out from there to figure out like what's causing this, nerve inflammation. Yeah. So, anyways, those are two situations where the nerve is inflamed, and we make decisions about whether a root canal is needed or not. But another major cause of needing a root canal is infection. Right? So if you have a cavity that has come really close to the nerve in your tooth, then you might need a root canal. And this is where you can get different opinions from different practitioners.
This is the gray area.
This is the gray area. We practice a lot of biomimetics here, which is the concept of conserving that nerve when it is not damaged, or we don't see any damage to it yet, or any symptoms to it yet, and we don't suspect any infection has penetrated in. So sometimes a cavity will go into the nerve, and the nerve has died long ago. It's necrotic.
It's necrotic, and you get swollen. Like if you're swollen, it's over. Like you can't just avoid the root canal anymore.
If the nerve in your tooth is already dead, And sometimes we could determine that you can have acute pain, swelling, puffy in the gums, puffy in the face, all that stuff.
Or like a bad taste coming in.
Yeah,
that's
like pus
that's the
draining.
pus draining into your mouth. Those are situations where it's already, not only is the nerve dead, but it's because the nerve died, now it can't protect itself. It doesn't have the blood flow, so now bacteria can grow in there, and that's why you get this pus and this infection growing.
Yes.
So the nerve actually can protect itself against these bacteria because of its blood vessels, but once those die, then
you're basically
exactly.
hooped.
Yeah.
And then that's when sometimes people are like, I don't have any pain. But that's because maybe they had pain 5 years ago when the nerve actually was in the process of dying. Now the nerve is dead. And then over the years, that infection grows in there and you end up getting an abscess. And sometimes those things don't hurt until that abscess, that fluid-filled infection gets big enough that now you have pressure pain.
So let's go through the typical trajectory. So you have a cavity, it gets deeper and deeper and deeper. You start having symptoms. It starts hurting to cold. It starts throbbing. It starts hurting when you touch and you bite on it.
You keep ignoring
You're just ignoring it. This is someone who just ignores you.
Yes.
Ignore. Okay, and then all of a sudden one day it stops hurting.
Yeah, it's like, when you ask people, they're like, it did hurt for a couple months, like last year.
Right.
I just ignored it.
And then it just stopped.
Yes.
And then now what's happened is that the pulp and the nerve have completely died. Like the cavity has infiltrated and the bacteria are in to that little chamber. So now that part is dead. So now the bacteria are just like reproducing in there. And it's like a beautiful enclosed area, which is what bacteria love, with no blood flow. So now they can just grow in there. So now time passes, you have no symptoms. Bacteria are reproducing. And then one day your cheek gets swollen, or you get like a little bubble on your gum, and that's pus coming out.
Or you go to your dentist, they take an x-ray and they see something on the x-ray, and you maybe not even have any symptoms, and they're like, oh, this tooth is infected and you need a root canal, and you're like, what?
Yeah. So shocking.
So it can happen in any of those things.
Yes.
Because you are a healthy individual with a good immune system, your body keeps fighting this. But sometimes these things, these chronic infections that have been sitting in your tooth and your jawbone really can flare up if your immune system is overloaded. Like you get sick, you get the flu, you're totally stressed out, you're not sleeping enough, whatever.
Right.
Like you throw off your balance in
You're
your
about
body.
to get married.
Right. Happens all the time. People are like, oh my God, like why does this always happen when I'm, going on a trip or about to whatever? It's because you've shifted your environment, you've stressed yourself out. Now this thing that was like being held off by your system has been
now
able
it has
to like
a chance to
sort of become a big deal, right?
Okay, let's rewind now. There is a time period where the cavity is getting closer and closer to the nerve, and it's close. And this is where the gray area is in the dental community.
To root canal or not to root canal?
To root canal or not to root canal. Has it affected or infected the nerve or not? And this is where biomimetic dentistry comes in.
I had a patient in the chair a couple of weeks ago who found us online because she had a tooth that she was told needed to be extracted. Right. She found us online about, I guess I spoke about something like this, and came in. And we were able to not just restore the tooth back up, but not even do a root canal on it, right? So sometimes when a cavity on an x-ray looks really deep under the gum line and close to the nerve of the tooth, dentists will automatically treatment plan an extraction of the tooth if they feel like the cavity is up under the gum line too far. And sometimes that does require extraction. Or if the cavity is close to the nerve on the x-ray, right? And they say, okay, well, this tooth needs a root canal in order to save it. But that is not a determining factor for whether a root canal is needed. It's the viability of the nerve in the tooth. So a cavity can look super deep on an x-ray, but if you test the tooth, there is no evidence of infection on an x-ray. You've had no pain, not in the past and not now. And we can actually test the nerve in the tooth to find out if the nerve is alive or dead. Now, if the nerve is dead and you're like, I have no symptoms, then I can say to you, well, the nerve is dead. Maybe you felt it a year ago, maybe you never felt it. Some people never feel pain in their teeth.
Right.
You still need the root canal. But if the nerve is reacting normally to testing, and we usually test it with cold, we just put something cold over your tooth and test it against the reactivity of your other kind of healthy teeth. If the nerve is functioning fine and the cavity is close to the nerve on the x-ray, we can still avoid a root canal in that tooth. Now, there's some caveats here. There is a possibility that the nerve is not affected yet, but that in the future that nerve will die and you will need the root canal.
Right.
It can always happen because there's been damage to this tooth close to the nerve. But our bodies have an amazing ability to repair. So if you have an alive nerve in your tooth and the infection is approaching it, your body will actually, the pulp will actually deposit more reparative dentin.
Yes.
It'll actually block. It'll build tooth
like
structure.
Dams.
Yeah, it'll build tooth structure just past it, and we call that reparative dentin. When you take a cavity out, you can see it. It's different. It's like a different color,
darker.
and it's a different feel than the rest of the tooth structure that was built when you were a baby, basically. So our body has a remarkable ability to deposit tooth structure and defend itself, and so we can often save teeth like that.
Yes.
And
But
not
it
doing
does take a certain amount of time and attention to these details.
and a lot of skill.
Yes.
To be honest, it is much faster and easier just to drill a hole through and start the root canal and proceed versus to very carefully. And when we remove cavities in teeth like this, we are really careful not to. Basically, we're actually leaving a little bit of cavity right over the top of the nerve area because we don't want to expose that nerve. And we're removing very carefully all the cavity in the surrounding area so that we can then we're depositing different materials to try and rebuild the inside of that tooth and protect the nerve, and to make sure we have a really good seal of the rest of the filling or whatever material we're putting in there against the rest of the tooth, and we're examining the rest of the tooth and really looking at it to make sure there's no cavity left around it. So we use rubber dams, we do all kinds of stuff to achieve this.
It takes a long time.
It takes a long time. We use special materials and products to rebuild the tooth. But we can often save teeth like this. We will always give you the treatment plan for a root canal in case you need it, so you understand cost. And it might happen in your future, but if we can hang on to a tooth's nerve that is still healthy and really trying to fight for you,
the nerve wants to fight.
The nerve wants to fight, and that tooth
give it a chance.
That tooth is much more likely to not fall apart in your lifetime.
Exactly.
So once you've had a root canal in your tooth, you've really weakened that tooth. You've taken out all of the defensive mechanisms in the tooth, first of all. And then you sort of hollowing out the tooth, you're drying it out. Those teeth are much more prone to cracking and breaking on you. And so often then we're sticking a crown on them, which is a whole other thing we can discuss.
I guess the whole concept comes down to efficiency, right? Because sometimes when a dentist sees a cavity that's close to the nerve, these things take time, and time is money, right? So depending on the philosophy of the dental practice, like when I was trained, the whole goal was to be fast.
Yes.
And now after practicing for 24 years, I realize that's the total opposite goal of I've become slower. It takes me much longer to get through procedures because I understand all these little details that matter.
Yes.
And so it just depends on the philosophy. Fast dentistry will be root canal crown. Slow dentistry will be more like what we're talking about. Let's look at it. Let's test it.
And
Let's see.
It's slow in so many ways. In explaining to your patients what's going on.
Yes.
The whole process, explaining all of this, and then to do the procedures. And then compensation. Insurance will pay more if you do a root canal, a post, and a crown on a tooth than if you save it with this intricate, complicated filling.
Yes.
Right? I mean, the price differential is huge with regards to what insurance will cover.
Yes.
And so that is a big deal. So if it takes us just as long, and really we want to charge for our time here, that's what's going on. And that's something we can talk about on another podcast. But it's about, are we getting compensated for doing more treatment or compensated for taking the time to do treatment that's less invasive,
Yeah.
but healthier for you. Because our goal should be that you keep your teeth for a long time.
Right.
And when you root canal, put a post and a crown on a tooth, that tooth is much more likely to fail you in your lifetime.
Yes.
That's the reality of
I think
what
this
we
is
do.
a huge debate in all of medicine, dentistry being a part of that, is, of course, doing a heart surgery, you're going to get paid more than if you sit down and do dietary consulting with someone. So,
Sure.
you know what I mean? Like, that's what we're doing. We're sitting there and, like, really diagnosing this tooth and understanding what it needs.
Actually,
and-
but consulting, wonderful. But we're actually doing a very complicated
Right.
procedure that requires a lot of finesse, understanding the materials, how they work. So it's just as complicated as the heart surgery.
Right.
It's not just the counseling part, but that is a huge part of it, because we need to educate our patients on why we're taking this other approach, because it's not quite mainstream in some situations.
No,
you know?
it's not. And it has to do with what you said, the compensation and the insurance reimbursement
And
really can
how
dictate.
we're getting trained, like you said,
and our training.
and our training.
I mean, do you remember the one doctor that we used to follow who would put up videos of how fast he can turn out crowns? And it was like a contest almost
It was
of
horrifying.
how quickly you can
It's like, I can do a crown prep in 5 minutes.
Yeah, I think it was. It was 5 minutes, and he would
Yes.
post videos on this. And this is like a source of pride for dentists, and
But it's not.
it's not for us. It's not.
No.
Like, I think that was just like shocking to watch.
Yes, it was. It really was. And then, so get a second and third opinion. Like this patient that I had who came in, who was told she needed extraction on a tooth that we saved. Then at the end of the visit told me, oh, that dentist also wanted to root canal the 2 teeth behind this one.
Right.
I was like, oh, well, they had pretty big cavities in them, but had he tested the nerve in them? I doubt it, because he hadn't tested it in the other one.
Right.
So she's coming back so we can test the nerve in them. And that's really how we want to determine, do you need a root canal in this tooth or not?
Right.
So, and it's not like dentists are out there trying to get you and charge you more money, but this is the training we've gotten. This is what we've been pushed to do. Do
Yes.
it fast, do this, This is how you get compensated.
Yes.
So there's a lot that goes into it.
The whole system is geared towards being quicker and faster.
Yes, and the way you get paid is to do more of these invasive treatments, and the way you're trained in general is to say, well, if it's close to the nerve. I mean, I remember getting trained in elective root canals. they would say.
Elective root canals.
Just go ahead and root canal it so that the chances of that tooth hurting down the line in the patient's future are minimized.
Right.
And so we would do that because we don't want you to have pain in a year and come back and blame us.
Yeah.
But now we have conversations. Hey, we're going to try to not do a root canal because there's so many benefits, but maybe the nerve's already affected. It just hasn't died off. We can't tell,
Yeah, we can't
so
tell
you might need a
everything,
root
but we
canal
want to
in your
give it a
lifetime.
chance.
But
That's
we
the
want to
whole
give it a
point.
chance. So
Yeah.
those are the conversations we have to have.
Yeah.
But part of what I teach at UCLA to my students is this,
Yeah.
You can sit down and have these conversations and
Yeah.
then make a decision with your patient about what to do.
But it takes time.
It takes time.
It takes time. Okay, hope that was useful.
Yeah, so if you think you need a root canal, go get another opinion and really find out if that's the only option for you, or if you think you need an extraction. Sometimes we can save teeth that look like they can't be saved by some
Yes.
dentists.
Yes.
So get some varying opinions and then make a decision, and understand that most dentists are coming at it from their knowledge base and where they're at and what they believe is the correct thing. And it's not necessarily to try and, get you.
No, it's not that.
But-
It's just the different philosophies.
Yes.
So, you can get different opinions and find the dentist who matches your philosophy. That's the whole point, is to find the person who fits you and who's going to be your partner in your oral health going forward. So,
And this is not a podcast against root canals at all. It's just about understanding when they're necessary and when they are being done electively to a certain extent.
yeah.
Yeah.
Okay.
Good.
Bye.
Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.